From the public health standpoint, this is a pretty relevant concept. The general idea of herd immunity is that if enough people in a population are protected from a disease, then that disease will have a very hard time catching hold and traveling within that population. So if you imagine a disease where one person will infect three people around them, then those people will affect three around them. You can see how something like that can really snowball. If that person is surrounded by people who are immune to that disease, suddenly that chain reaction stops right there. You don't get three people infected who will then infect another three people. And the result of that is another person who is not actually vaccinated or not protected, who's further in the herd, is protected because of all these people in between who will not actually be passing on this infection. So, that's the idea, is to decrease the likelihood that that infection will catch hold. And it won't mean that there wouldn't be cases sporadically here and there, but it'll stop things from becoming epidemic or pandemic, because it just really, really constrains how quickly something can spread. So, depends on the infectivity of the virus that you're talking about and what percentage of the population is actually getting vaccinated. But some early estimates were that, if we were around 70+% of the population being vaccinated and protected, that maybe we would be at the level of herd immunity. There's some revisions to that number saying that maybe it needs to be a little bit higher, but there is a certain level. You don't have to immunize 100% of the people in a population to start getting rid of these problems. And what you'll have is sporadic cases here and there that will just sort of die out without spreading. So that's the idea of herd immunity.